Well, welcome, Melanie Walker. Thanks so much for joining us today to talk about the walk to the lighthouse.
Thank you for having me.
So this is the fourth year that this has happened, and uh, it, tell us a little bit about how it got started and how it's been growing in the first few years, and why it's happening. I suppose why there's a need for this type of fundraiser in Burlington.
Okay, sure. So it is our fourth year doing it. It began in 2020, began very small. It was more of a grassroots thing. It was just the Patient Family Advisory Council, which is a committee made up of um, staff as like in mental health, as well as people with lived experience. So that's a committee that just is permanently there. And they decided that they would do a walk, and they called it Walk to the Lighthouse. There was probably maybe 30 people that first year. It was basically just family and friends. The main purpose was really to raise awareness and reduce stigma. And then the second year, it went a little bigger. I helped promote it a bit internally with staff, and we had maybe 70 or 80 people. And then the third year, which was last year, we had probably about 300. So it was a big jump. Um, and this year we're trying to do at least as well as that, hopefully better.
Well,
And
it's something. This is the first year it's kind of come onto my radar, and that's uh, uh, my fault, so to speak. I'm probably not paying close enough attention to my community, but certainly that speaks to how it's growing and how awareness is of this as an annual event is growing in the community. So that's a good sign.
it is a good sign. We're very pleased. There's been so much support from the community, from local businesses. We have like lots of sponsorships and prizes more this year than last year. So we're very excited about how positive the response has been. You asked me about what the need is. So what we're doing is it is to raise funds for the redevelopment of mental health and addiction services at Jo Brant. And so I don't know whether you know much about the need for redevelopment. Um,
A little bit, yeah. Over the years, I've become
Well,
aware. For
well,
yeah.
why don't you share with us, just because our listeners might not know exactly what the scope of the need is at Joe Brant in the community.
yeah, so um, we have a pretty dated facility for our services. Our inpatient unit is 18 to 19 beds. It kind of fluctuates, and we're kind of always there's always high need, high demand for these beds. There's really no private rooms. There's limited number of showers. There's just not a lot of privacy. There really hasn't been much updating in it since it was built in the 60s. So our hope is that we build something that is more conducive to the needs of our people that we serve, so that they can heal in a more therapeutic environment. So that's our inpatient need. Then we have our community mental health. That's the side I'm on. And we were housed in the basement of a long-term care facility. We recently had to move, and now we're spread out throughout the hospital. We're in, I think it's 3 or 4 different areas right
So
now.
you've moved, but not necessarily. I mean, I am actually
Permanent.
aware of how you were in the basement of a separate building from the inpatient where the inpatients are.
Yeah.
For anybody not familiar with Joseph Brant, uh, it's it recently had a very large new patient tower was built for sort of mid 20 teens. And there was talk, I know, at one point that you know, I know it's the first time I heard was back then, sort of around the time that was being completed, is like, well, what we need now is definitely a phase two, and the thing at the very top of the list is mental health
Mhm.
services that are still in the old part of Jo Brant Hospital, and also, like you say, split up. So now the need is just getting more and more. And I guess maybe you could speak to how, um, I my understanding is that certainly, when COVID hit, the demands on mental health services in every way, in every level, every facility across Canada, I'm sure, was just absolutely deluged with people needing the assistance. Has that sort of returned back to a more normal level, or are you still seeing those kind of elevated that, I guess you're basically seeing a constant growing need anyway, but
there is, and it's hard to say. Is there more need? Is there more awareness? It's probably a bit of both. Certainly during COVID, I would say there was just more need. People were really struggling. We had a few specific populations that I think struggled more. One of them being like the child and adolescent, especially the adolescent age group, those in high school or transitioning to university. Very rough time. The other population was new moms postpartum. We saw an increase in referrals like I can't even describe. And there was a number of reasons for that. One was, I think, all the rules that were in place. You have women maybe having first babies, and we've got rules in place that nobody's allowed to come over to your house, right? So that natural support that would have been provided by maybe a grandparent, and maybe people are fearful, there's no vaccine at that point. It was just, it just set people up, right, to be very isolated. I remember talking to people, and they had babies that were 9 months old, and they'd never met another mom and a baby.
Wow. Yeah. And that could, sorry, Joe, go ahead.
I was just going to say, that how you're describing the need for this service in, I'm not going to say Burlington, but I was going to say like Halton as well, just like kind of a broader catchment area. Can you maybe give an insight to our listeners? What exactly do you provide? Because we say mental health services, and I think some of our listeners, I know I'm for one, have a hard time kind of wrapping my head around like what does that look like. I can understand. I go into a hospital, I have a broken arm or I have an illness, I go to the designated treatment ward, and they give me the needle, they set my arm, they give me the medication I need, and I'm good. My doctor looks after me. Mental health, I think part of the stigma is that we don't quite understand what does that look like. It's not as simple as, here, let me hook you up to the machine, you diagnose with an illness, and here's 2 pills, and call me in the morning. Can you tell us a little bit like what does treatment look like from your end? And of course, without divulging any details of people's treatments or whatnot, but just give our listeners a bit of an idea of what does mental health treatment actually look like.
So it really depends on the person. It really depends on the symptoms they're struggling with, the length of time, what the diagnosis is, because each diagnosis would maybe respond differently, depending what the treatment is needed. I get about 400 referrals a month because I'm the intake coordinator. The things that I refer them to, I'm the starting point in terms of where it goes from there. My referrals come from Emerge, and they come from the unit, and they come from the community, from family physicians. And so what that looks like, often people who have presented to Emerge, it's because they've been in crisis. Things have reached a point where they feel like they can no longer cope. Maybe something has happened. And so we need to put services in quite quickly. What that would look like, maybe an urgent consult with a psychiatrist, maybe a referral to our FAST program, which is basically, it's for acute stabilization. It's through groups, it's through an individual clinician as a touch point, and also access to a psychiatrist. It may be that they need more coping skills. Maybe once they get through that acute phase and things settle down a bit, they still need coping skills because, maybe this has been going on a while. And so then we have our short-term therapy program. We have our DBT program, which is dialectical behavioral therapy. That's for people with any type of emotional dysregulation. And we also have access to the Burlington Family Health Team. We have a partnership with them, and they do more of like cognitive behavioral therapy, mindfulness, IPT, some trauma work.
So now when we're talking about you're raising funds for this department at Jo Brant, and so you're talking about the beds that are needed, shower and care facilities, that kind of thing. Typically, like if somebody's admitted into this ward, I think it's a safe description of this department. Like what's the stay like? Are they in for a weekend? Is it in for until you get better? Because I can imagine some people's mental illness, as you said, it's not you're going to be fixed in a month and then you're out. It's this might be a lifetime of coping and learning how to deal with it and to go with it. Some people might be, nope, it's a bout and I need a few months to work through it, and I will everything's different. So I'm wondering, like, what the facility that we're looking at here, how does that operate for these people?
Unit that we use, basically the beds are used for acute stabilization. We, sometimes acute stabilization can vary. It could be overnight, it could be a few days, it could be a month or two, right? That's unusual, but depending on the diagnosis, and you're right, there are some illnesses, like you look at some of the chronic persistent mental illnesses like a psychosis, schizophrenia, bipolar, where things tend to be cyclical, right? And you'll have some stabilization and then you'll have a real period of instability. And sometimes, depending what's going on, depending what else is going on in terms of diagnosis or even an addiction, can just make it really challenging to stabilize someone. And so
sorry, go finish your thought. I interrupted you. I'm sorry.
Yeah, that's okay. So it really depends, like how long that admission would be. It would basically be to try and stabilize and then try and refer to something in the community, whether it be ourselves in community mental health or maybe one of our partners in the community.
So it sounds to me like your department is kind of a department of last resort, almost. People who are really working through their mental illness, whatever that may be. They've reached a kind of a wall in their treatment or the course of their coping with it, and that this is a safety net almost to catch people before they go. I don't want to be too graphic here, but do inflict harm or do something that they're going to regret to themselves or maybe to others.
Yeah, so certainly our hope is to catch people before that happens. And you're right, sometimes people present to emerge after the fact, after something has happened. I would describe our services as higher intensity level. So, it might be, I always tell people, start with your family doctor, right? If you've had symptoms of depression or anxiety, go talk it over with your family doctor, because there's stuff that can be done at that level. Maybe medication can be started. Maybe there's a social worker who's connected to the practice, and you can start seeing them and working on some coping skills. If things are not progressing as we would hope, it's becoming maybe more treatment resistant, or a higher intensity is needed, then often people get referred to us at that point. If a family doctor has tried a few antidepressants and has had no response, often they want a psychiatrist to weigh in on what is happening here.
And I just want to ask this final question for now, and I'll pass off to you, Roland. In your as the intake coordinator for this program, have you seen an increase in people kind of at this limit, at this point, coming to you, or are we kind of plateaued? Because we keep hearing about there's a mental health crisis in Ontario, and I'm wondering, as somebody who is kind of in the thick of it, are we seeing an increase in the need for these services and this type of facilities across the region, or is this just something we're playing catch up to?
I think there's no shortage of referrals. They keep coming in steady. I don't think there's been really a terrible reduction in them since COVID. When I've been in the intake role for about 13 years, and when I first started in that role, in the summer, I would get maybe 60 referrals a month. And now,
Wow.
yeah, right. And then August was my highest month. I can't remember what it was, but I think it was like 489.
Wow.
It was really high, right? So that's over 13 years. Now, why is that? Is there higher need? Is there more awareness? Are people more willing to come forward? Is there less stigma? It might be a bit of everything. But I would say the people that we are serving are often at a much higher intensity level than when I first started 22 years ago.
Is that just because people are not being proactive on their mental health? I mean, it is something that I myself struggle with, like, suck it up, Joel. Like, it's not that big a deal. Don't be a baby about it.
You invalidate yourself.
Well, are you going to charge me or? But I do think, like, I try to be more cognizant of my mental state and whatnot, and that is because of awareness programs going around. But I do believe that there is a prevalence of it's not that bad. I am taking away resources from somebody who does need it. I'm not going to burden myself on the public health unit because
I'm going to jump in there and say,
sure, go ahead.
And John knows I've had some mental health things over the years, and actually, you know what? I wasn't going to mention this, but why the hell not? I've used the services at Joseph Brant Hospital as an outpatient, and I'm very grateful for that. It was during COVID, actually. Yeah, well, that was kind of coincidental, but it was, everything just after everything went onto Zoom, and it was fantastic. And but it was also clear to me at that time that even via Zoom, that the accommodation was not what one might hope for in an ideal world. It's cramped. I mean, that's all I could see. It's like, it'd be nice if staff had bigger offices. Well, I mean, but that sounds like I'm saying they need, they're looking for a luxury. But no, it's like, this is really not ideal accommodation that you've been dealing with for a long, long time. As demand grows, or has grown certainly, kind of almost exponentially. And to an extent, mental health has become a victim of its own success, I suppose, in that because we have broken down a lot of stigmas, more people are willing to go and talk to someone now than ever in the past. And actually, just with Joel talking there, I wanted to talk to an extent about my experience of, places where I've run into other people who've been engaged, interacted in whatever way with the mental health services. I've made it clear that generally women are far more willing to seek help, and to also receive help from not just professionals, but also family, friends. Women are better at talking, if you see what I mean. It's a cliche, but there's certainly, I think, an element of truth to that. Is that something you're still finding that
I agree with you.
I feel that men have a real mental health problem these days, or not all men, but many men, but there's still that much greater reluctance to seek out help. Maybe because like Joe said, well, I don't want to take services away from somebody else. It's not that bad. I should just suck it up.
Yeah.
How important is it that men actually get away from that perception?
Probably pretty important, right? Because we know that when mental illness or mental health issues are not taken care of, they're often progressive. And they can affect every area of your life. So, now it's hard to go to work, or now it's hard to keep the job, or now you're having lots of conflict with family. Your motivation's low, your energy's low, you're kind of dragging yourself through life. It's affecting you, and it's probably affecting a lot of people around you as well. So no, I think it's very important.
Mhm.
Not to get too graphic, but I mean, you know, like suicide is a real thing, and men tend to do things that are more successful, or like,
It's, I mean, if I'm, correct me if I'm wrong, but I believe it's still the case. I'm just realizing that I didn't close my closet behind me, so I'm trying to stand in front of the door here. Not that there's anything to be ashamed of in there, but you know, I'm so professional.
Just the
But
skeletons.
yeah, just the skeletons, exactly. They're coming out too, obviously. No, but the yeah, I mean, I think it's fairly well established for around the world that, you know, the highest cause, well, certainly one of the, if not the highest cause of death amongst men of a certain age, sort of young adults, I think, is suicide, and it just breaks your heart
yeah,
that this is happening. That people, and I think there's so much isolation very often that goes into this. It really, this just goes back to the need for, you know, not putting mental health at the kind of bottom of the list of needs at any hospital, but kind of near the top, right?
absolutely. I mean, because it affects your mental health, it affects your physical health as well, right? Because then often when we're not feeling well mentally, we're maybe neglecting things. You know, we're not going to the dentist, we're not going for those physicals, we're not following up on our blood work, we're not eating properly, we're not exercising. So it has this sort of ripple effect.
It's yeah. I mean, obviously, I'm a convert, certainly, as as someone who's brought up to think, you know, just deal with it. It's like,
Yeah.
no, you know, many of us, perhaps most of us, at some point in life, could do with some level of help. Whether, like you say, ideally you go to your GP first, and they can direct you somewhere. You don't, you know, once you've and you know, the outpatient services at Jo Brant, for instance. I mean, the kind of help that you're providing there. I mean, that might be, I guess, a meeting with a psychiatrist for some kind of diagnosis, or it could be, you know, it could be like something like ADHD, or
Yes.
it could be all manner of things. But it's also sort of teaching people the kind of coping skills that they need to avoid getting to the inpatient end of things, I suppose. Is that right?
Absolutely. I mean, I think what we need to understand is everybody has mental health. The same as we all have physical health, like I need to eat properly, sleep properly, exercise to keep my body functioning. There's things I need to do to protect my mental health, right? And if I don't do those things, or if I'm predisposed maybe to a mental illness, I mean, it's a continuum. Everybody can benefit from healthy coping skills. I mean, everybody I have in my DBT group, I run a few dialectical behavioral therapy groups, and they're very practical emotional regulation skills. And everybody always says, why aren't they teaching this in school? Right?
Yeah, really.
Because everybody could benefit from it. But somehow it gets stigmatized, and then, you know, people miss out on just skills that we all need.
So, I mean, in terms of, I mean, this is a fundraiser, so you're actually raising and collecting money.
Yeah.
Now, I'm going to guess that even if you get, even if your expectations exceed your greatest hopes, and you thousands of people turning out and raising money this year, you're going to be a few $1 million short of a new mental health wing. So what needs to happen for this to actually go ahead? I mean, it's going to need more than I mean, what you're doing is you're raising awareness, and you're doing something really practical, and that's fantastic. But who else needs to step up to make this happen?
Yeah. So I know that there's conversations happening with our local MPP. She's very involved in this. She will be speaking at the walk. She has pretty big investment, I would say, in mental health, if you know her story.
Right. Yep.
Right. So, you know, she's been, I think, a really good advocate. And so it is about, you know, making this a priority with our government to fund the project the way it needs to be. And, you know, that takes time. But in
And
the, yep, go ahead.
yeah, it doesn't. Well, I mean, like the original the last phase redevelopment of Joseph Brant, that was a long time coming, as I recall, and there was uh, calls made for a long time that eventually came to fruition. So let's hoping, because it really, it's a shame that the job wasn't finished, so to speak, for the hospital as a whole. That you know uh, that new patient tower came along, and the hospital really changed in a really positive way, I think, for anybody who's been there.
Yeah.
But but it's, you can go through the door into the old part of the hospital, and it's like, yeah, this could do with some upgrades here, and I know that's your part of the world.
Yes. Yeah. Yeah, it's just about being patient, and I think, we're not naive to think that our walk will, raise the funds that's needed for redevelopment. It will, at the end of the day, be a drop in the bucket, and a good drop in the bucket, because
Yep.
basically it is raising awareness not only of the need for the redevelopment, it's also raising awareness that these services are really important, that we need to have accessible and timely care in Burlington, and that our services are here, that we're open for business, and that people don't need to struggle alone. They don't need to suffer. They can reach out, and help is here. But we're only going to do that, and especially, I guess, with the men, is if we reduce that stigma and make it okay, normalize it. That was the
Yeah,
thing.
I'm
Yeah,
more
go.
than happy to second you on that. But yeah, I mean, it's really important. There's just like you say, the suicides are one side of it, but that's tip of the iceberg isn't really the phrase I'm looking for. But there's a pyramid of
Mhm.
male unhappiness, and I'm not saying that women don't. Of course they do, of course they do, but they just tend to be better about acting on it. There's so many men who are suffering their whole lives long and not doing anything about it, and it can end in all kinds of unfortunate ways. I mean, it's like if you don't treat a problem with your leg, the leg's not going to get better on its own. It's like you say, it's exactly like a physical thing. You need to treat the problem if you want it to get better. So yeah, certainly I'm a big fan of saying, if you're a man listening, and don't be shy, go for it. I've done it. It helped me enormously.
Yeah.
Uh, I just wanted to maybe just chime in a second and give you a chance, Melanie, to, if anyone else is partnering with the walk that you think needs to, I guess no pun intended, have light shone on their efforts to help you out. Can you maybe give our listeners a bit of a chance to highlight their work or highlight their contributions?
So do you mean the people who are helping to put this walk
Well,
on?
yeah, I know that you're reaching out to, you said that you were reaching out to sponsors and you're looking to get help. And I'm just wondering, do you have sponsors already lined up who are
Mm.
wanting to help you accomplish this goal? Because I think our listeners would like to know who or what they may be.
Yeah, Beverly Cocking. They're local. They're in Burlington. They have been fantastic in terms of their, not just their financial support, but also very practical support. I met with Scott on the weekend, and he was like, I think maybe I can bring generators, I can bring this, I can, right? Like, just like very hands-on, very practical. His wife, Sarah, she's been so helpful with, sort of mobilizing some people in the community. We've had, so that they would be our number one, supporter, financially, and I would say otherwise. And then we've had like just a number of local Burlington businesses that have been willing, not only to give prizes, but a few businesses that have been able to, have been willing to have our merchandise in their store. We have merchandise this year, and that's a new thing. We have Lighthouse bracelets. We have like Lighthouse bracelets
Mhm.
and dog bandanas and t-shirts. And so there's a few places throughout Burlington that have allowed us to put displays in at no cost, which not only raises some funds, but more importantly, puts this event on people's radar.
And we should say, I think Joel was just about to get here too. We'll put the links in the show notes and everything. But if anybody listening wants to get involved, wants to find out more, wants to take part in the walk, maybe raise some money, where should they go?
Yeah, so if they go to walktothelighthouse.com, or if they go to the Equilibrium Burlington website, that would be another way. Also through the foundation. There's donate buttons. If you go on the donate button, it'll link you in, and there's all information on the walk, and ways to set up a fundraise page, or to join a team, or to sponsor a team or a person.
Well, you beat me to it, Roland. So I'll give you the credit on that. But I mean, I think this is a great initiative by you and your team, Melanie, and that and I think you're right. As our awareness, or as this awareness and the stigma, I was gonna say, the awareness grows and stigma breaks down. The need for what you're doing is going to be more and more, especially to just to meet people where they are, and to help that dialogue, and help that coping and healing happen, that to ultimately prevent things from getting too worse.
Absolutely. I mean, prevention is obviously ideal, and having those services in place when people desperately need them is also needed, right?
Mhm.
Can't always predict, or people, just have different times of readiness, and that's okay too. We meet them where they are. I do think we're, making a dent in stigma. I really do. When I walked last year, as I said, there was probably about 300 of us walking along the waterfront, and people were stopping us and saying, "What are you walking for? What is this?" And people were openly saying, "We're walking for mental health." And I thought, oh my gosh, like in my 20 plus years, I never thought I would sort of hear that, where people were just openly saying why they were there. There was no stigma. It was the most amazing feeling. I have to tell you, that feeling, I think, carried me for many months after, motivated me enough to do it again.
It's infectious.
Yeah, yeah.
And you need that, because these things take a huge amount of work, and you deserve, you and the whole team deserve a lot of credit for doing this and coming back year after year to do it again, and to grow something really special in Burlington. And I have to say, having lived in Burlington for a couple of decades, I've never been to the Lighthouse yet, so
Yeah.
I really should walk there.
Hey, you gotta join us on the 22nd. So we walked towards the lighthouse. It's like we used to, the first year, we actually walked over the bridge, and now it's like there was construction, right? There's construction now, you can't get over easily. So we just walk towards it, and then there's a turnaround point right where the lift bridge is, and we actually have a water station there, and we have a dance company, and so there's a little bit of entertainment, and people hold a sign that says, "I made it to the lighthouse," and they take their picture with it, and then they turn around and come back. So it's it's a really great day.
Here's a silly question I probably should have asked you. If you're a young family, you have kids with strollers, would this be an excellent opportunity to just get out and enjoy a day?
Yes, and bring your puppy too. Yes, dogs
So
on leashes are welcome.
no excuse for families not to
No.
join in then.
No, we had a lot of families last
Good.
year. We had strollers and wagons and dogs on leashes, and yeah, it's just like a real family event. It's not a race, right? It's a walk. And I had one woman last year, and she did the entire thing with a walker. Walked right to the end and back.
Mhm.
And so it's all ages, all abilities.
Good for her.
Yeah, exactly.
Well, thank you, Melanie Walker, for joining us today to tell us about that, and some more about Jo Brant Hospital and the needs that you have there. And I hope to see you on the 22nd, right? I'm getting the date right. Let me not just mess that up. Like 22nd of September.
Sunday, September 22nd at 1 p.m.
And I hope maybe some of our other listeners will come down and join us too. Be great. I think this is a like I say, the minute I saw the minute I learned about this, I thought this is a great thing and something we wanted to cover and to raise awareness about.
Absolutely. And there's no registration fee. So, I mean, you can just show up, and I think that's the best part. My committee feels so strongly about that. It's the most wonderful committee. I haven't had a chance to give them a big plug, but everybody on my committee, most of the people have lived experience of some sort, whether it be themselves or as a family member. And then I have a few people who are like care partners that have partnered with us to help. And it's just, it's a lot of work what we do, and we're a mighty little team, and we work really well together. But they felt so strongly that the walk should be accessible to everybody, and so there should be no barrier. And we'd rather you walk than have your money. Like we'd just rather you be there.
That's terrific. I think that's a really good point for something like this. Well, thank you again, Melanie. Really appreciated it, and we shall follow the walk with interest, and I gonna hope to be there myself.
I hope to see you both there. Thank you so much for having me.
So, thanks. All right.